Hello. Hello. A very good evening to everyone. We'll wait for a few minutes and we'll wait for a few more to join, and then we'll start our discussion. Hello. A very good evening to all of you. I'm Dr. Meenal Mittal. I'm a consultant dermatologist from Aligarh, UP. So today we are here to discuss about melasma, its prevention and its management. As we all know that melasma is a very common problem and it affects females commonly as more as compared to men, and it has got a great psychosocial impact also on the life of the patient who have melasma. So if you have any queries regarding melasma, its prevention, its management causes, you all can drop them in the chat box and we'll answer them. So starting from what is melasma? Melasma is a chronic condition. It is a pigmentary disorder which is multifactorial also. There are so many causes that can that can precipitate melasma and can lead to progression of melasma. Melasma, what we call as jhaya in Hindi, and pigmentary marks in sometimes when it appears during pregnancy, it is known as chloasma also. It is common in it can occur in both females and males, but it is more common in women and especially in the reproductive age group. It is rarely present in females before puberty, so it mainly affects after puberty and in the reproductive age group. Based on the sites, melasma can appear over the centrofacial area of the face, means over the forehead, over the nose area, the upper lip, and the chin. It can affect the this medial side of our cheeks also. It's called the centrofacial pattern. Then the other is the malar pattern, which mainly involves the bilateral cheeks, the nose, the dorsum of the nose, and then there is mandibular melasma also, which mainly affects the mandibular area of the face. It is commonly seen in the postmenopausal females. That is, after menopause, if the melasma appears, it can occur over the mandibular area also. However, during pregnancy and because of sun exposure, mainly affects the centrofacial part and the malar part of the face. Now, melasma is commonly occurs on the face, so the can occur on the sun exposed parts of the body. It can occur over the face, also over the upper part of the back, the nape of the neck, and the front of and the neck area also. However, it is more common on the face. Now, based on but the if it but if a patient is having melasma, then it remains for life. It is not possible to completely cure melasma. So there are so many measures that can be taken so that it will not aggravate, so that the problem of melasma will not aggravate, and so we'll discuss that in after a few minutes. And before that, we'll discuss about the types of melasma based on the depth of the pigmentation. It can be melasma can be epidermal type of melasma, can be dermal type of melasma, and can be mixed type. The epidermal type of melasma is melasma that mainly affects the most superficial layer of the skin, that is epidermis. It is brownish in color. It is brownish in color and mainly affects the centrofacial part of the face. It is more responsive to treatment as compared to the dermal part, and it has got well-defined margins also. And as compared to the epidermal type, the dermal type has got ill-defined margins. It is deeper pigmentation. It goes to the dermis also. The pigmentation is there in the dermal layers of the skin also. It is ill-defined, grayish in color, blue to grayish in color, and it is more stubborn to treatment. It is very difficult to treat the dermal type of melasma or the mixed type of melasma that includes both epidermal components and the dermal components of melasma. And the treatment options are also uh, treatment options should be advised according to the depth of melasma that we can see either through a Woods lamp examination or through a dermoscope, whether it is a dermal type of epidermal type of melasma. Um, for that, we can use a Woods lamp or a dermoscope. Now, coming to the causes of melasma. The causes of melasma, as I told you, the pregnancy. Most commonly, it occurs in females and the reproductive age group, and sometimes it also presents in the starts in the during the pregnancy or postpartum period, and it is known as chloasma also. And other causes of melasma that can be any hormonal causes and can be due to any thyroid disorders. And the people with thyroid disorders have 4 times more chances of getting melasma as compared to the normal patients. So, and other causes can the sun exposure or sun aggravation is a major factor that aggravates the melasma. Whatever may be the cause, but sun exposure will aggravate the melasma, and sometimes it is the cause. It is the main cause that because of which the melasma has appeared over the face. So it is very important to protect your face either through a physical barrier or you cover your face while going out, or either you use a sunscreen or a sunburn lotion or any photoprotective cream of SPF 30 that will prevent the damage and pigmentation on your skin. So now, other causes that can precipitate melasma are any oral contraceptive pills, any drugs like phenytoin. All these can also cause pigmentation similar to melasma. So, it is very important to use a sunscreen. However, the drug-related pigmentation is mostly reversible, but sometimes it is difficult to treat the drug-related melasma also. So, sun protection is the most important factor that helps to prevent the melasma. Uh, now, we think that if we are indoors, then we don't need to apply a sunscreen or sun protection. So we don't. We usually do not use sunscreens when we are indoors. However, there are reports that the visible light and it has been proven that the visible light inside in um, the indoor lights also it can also precipitate pigmentary problems. So it is important to use sunscreens even when you are indoors. However, you can reduce the frequency when you are indoors, and but you have to use the sunscreens even when you are indoors. Now, coming to the prevention of melasma. For the prevention of melasma, the first and the foremost factor that you have that is important is the use of sunscreen. The sunscreens and the SPF, that is the minimum SPF that is to be used is 30 SPF, and the PA plus rating should be minimum of 3 plus. Now, it is how to apply sunscreen and how frequently you should apply sunscreen. That is another important thing which you should keep in mind before, because just applying a sunscreen is not beneficial. If you apply a sunscreen once in a day, it is not beneficial. But you have to apply it at least 2 to 3 times in a day. Every 2 to 3 hours, you have to repeat the application. You have to take the sunscreen from your the quantity I am telling you from the finger crease to the tip of the finger. You have to take the sunscreen, then apply over the face, and then spread it by the two fingers of your hand all over the face and over the neck area. You have to apply your sunscreen, and you can take a cream for your face and neck, And for larger surface body areas like over the hands and over the back, you can use sunscreen lotions to cover a larger body surface area, and repeat the application after every 2 to 3 hours. And if you are coming after swimming or any vigorous exercises, you have to repeat the application immediately, because uh, you can use water resistant or sweat resistant sunscreens also are available, but then too you have to apply the after swimming and after vigorous exercises, you have to repeat the application. And along with melasma, if you have you have complaints of oily skin or acne prone skin, you can also apply gel based sunscreens, so that it will not precipitate other problems along with melasma. Now, there are two components of a sunscreens, like inorganic and the organic types. The inorganic sunscreen, along with the organic ones, the inorganic components are very important because they provide protection against the broad spectrum of the UV rays, and with that they have a tinted effect also sometimes. Which also gives a camouflage like effect, and uh, so the pigmentation on the face is less visible, and you there are camouflage options also that I'll tell you later on, so that they are less visible pigmentary problem. The pigmentation is less visible. Now uh, along with the sunscreen, for prevention, underlying the treatment of the underlying cause is also important. So whatever may be the cause, if there is a thyroid disorder, should be treated. If there is any other hormonal problem or any other drugs or pills you are taking, so it should be stopped if the problem is aggravating. Now, coming to the treatment, the first line of treatment for melasma, that I've told you already, that is sunscreen. Sunscreen is the most important part of the treatment for melasma. Along with the sunscreens, there are many options available. There are many components like that I'll detail one by one. These are like kojic acid, the azelaic acid, then there is arbutin, niacinamide, and there are newer components also like silymarin and the plant extracts like resorcinol, and all these are the newer products. Then there is vitamin C also, you can use at serums also. It is a good antioxidant agent. It will prevent UV damage to the face also, and will also provide sun protection, and it is an antioxidant also. Now, the most conventional and the most oldest treatment for melasma, the uh, is the hydroquinone. However, hydroquinone, when the patient comes to the clinic, now I'll start with how the patient presents. When the patient presents to the clinic, he or she has already applied so many things to the face, which may have aggravated the problem also. So it is very important to ask about the history of what other drugs or what other topical agents the patient has applied. Like when the patients come, they have already applied the triple combination creams for a longer duration, and for any corticosteroid creams. However, the triple combination also contains the hydroquinone and the corticosteroids, but that is in strength which is required for to treat melasma. Sometimes the variable strength of hydroquinone and corticosteroids can damage the skin more than they are beneficial. So before using anything for your face, you should consult your dermatologist and should take a proper medications for melasma. And like triple combination, they have variable hydroquinone strength like 2 to 4% can be used, but hydroquinone can also aggravate exogenous ochronosis if it is used for a longer duration. Like sometimes you give patient hydroquinone triple combination to apply for few weeks, then come after few weeks, and the patient keeps on applying the combination for 5 to 6 months, and then they come and they say doctor, now the problem has aggravated before that it was 4 months back, and now the problem has also more aggravated more. So it is very important to counsel the patient when you're giving when we are giving triple combination creams, because to avoid that there are other components also that can be used, like kojic acid, arbutin, azelaic acid. All these p-terovite is a new component also, and silymarin. All these are new components that can be combined, that can be given in the creams, uh, so that along with the sunscreens. Okay. You can put, if you have any queries, you can drop them in the chat box. I'll answer them. Now, coming to the different components like kojic acid also inhibits tyrosinase enzyme. It has got a deeping, brightening effect, and it is safe also, kojic acid. And then there are components like arbutin and vitamin C, I have already told you, and other therapies that can be used are, sometimes patients have this they want immediate response, immediate, because of any event or any event coming up in the family or anything, so they want immediate response. For that, sometimes you can take oral drugs also available for melasma. These are like tranexamic acid. Oral vitamin C supplements can be given, and then there are newer supplements like polypodium also that can be given sometimes. And polypodium has also got a nice antioxidant effect, as well as it prevents UV damage, and it can also be combined with other topical creams and sunscreens. It can be combined, and other than this, tranexamic acid can be given for some duration, and it has got a good response. Tranexamic acid also for maintenance also, and it prevents relapse for a longer duration. It has got a sustained effect. Tranexamic acid has got a sustained effect. Then there is then up, along with the topic sunscreens, I've told you the topical creams that can be used. Then also there are second line therapy. If the patient is not responding to these oral and topical agents, then we can advise some chemical peeling for also for the melasma, like peels like glycolic acid in variable strength from 25% to 70%, and TCA can be given 10 to 30%. All these things can be given but that only a dermatologist, or you have to contact your dermatologist for that. You cannot use these combinations at your own, because the depth um, because the strength also decides the depth of penetration of the agent. So for that you have to consult your dermatologist also. Then chemical peeling, variable, different chemical peelings that I've told you, glycolic acid, TCA, Gessner solution. Then there is tretinoin peel also. Then there are combination peels also, which there are peels like salicylic acid also, which are mainly advised if there are oily skin or acne prone skin, then you can combine this. Uh, then you can use the salicylic based peels, which provides improvement in the oily face also, and then along with that improves melasma pigmentation also. Firstly, it is important to assess it through a good slam, so that we can see whether it is epidermal or dermal type of pigmentation, and accordingly we can advise the strength of the peel or the peel for the patient. Now, there are some newer agents also which are approved for melasma, but like cysteamine and licorice extract, these are also used in these. Cysteamine is not available in India, however, it is approved outside. In India, then licorice extract, arbutin, all these things are combined, niacinamide, all these things are combined in the deep in the lightening cream, so they usually do not cause any side effects also. Because if you are using hydroquinone for a longer duration, more than 5 months, 6 months, it can it along with the steroids, then they can also cause side effects like telangiectasias, atrophy, and all these side effects, erythema of the face, all these things it can cause. Now, after this, okay, okay, there is a question, and Mohammed Sahil is asking, please suggest the best sunscreen. So, an ideal sunscreen for melasma should be at least SPF 30, and if you're, there is, um, you can for that you can use a gel-based sunscreen also that are more. They have a uh, whitening effect also, and that you can use the gel based sunscreens, and especially if they should have a component of physical sunscreen ingredient also, like titanium oxide, zinc oxide, should be there, because they provide a wide range of protection against the UV rays, and the PA 3 plus rating is sufficient. For Indian skin, the Fitzpatrick skin type 4 to 5, 4, 5. The SPF 30 is sufficient. Or more than that, you can use SPF 40 or 50. But if you're using a sunscreen with 30 SPF, it is good enough. And now, and that I've told you, repeat application of sunscreen is also very important. And if you are going out, apply sunscreen at least 15 to 20 minutes before leaving, and apply even when you are indoors. Um, okay. Now, I told you about the oral drugs, the topical drugs, the chemical peeling. Then there are some other methods like microneedling also. These all procedures can be combined if there is resistant type of melasma or the because of the stubborn nature of melasma. Some treatments can also be combined and advice to the patient. Now, coming to the laser part, there are lasers like U-switch and DIAG laser for that are effective and approved in the treatment of melasma. Uh, can be used for any pigmentary disorders like melasma, any nevus and PIH. In all these cases, Q-switch and DIAG laser all can be used. And okay, if there are any more questions, please put them in the chat box. Then we'll finish finish the session. Okay. So there are no more questions coming up. So to summarize in short, melasma is a chronic pigmentary multifactorial disorder in which there are brown patches or macular lesions present bilaterally symmetrically over the face, or the can also present over the hands and the sun exposed areas of the body. For the prevention, the most important thing is sunscreens with SPF 30 and PA3 plus rating with physical components to prevent from the sun damage and the UV rays. And along with that, a physical barrier, you can use a broad brim hat, and you can use protective clothings, full sleeves clothings, and you can wear cotton clothes also to cover your face so that it will prevent aggravation of melasma. For prevention, sunscreens are the most important part, and for treatment, according to the epidermal and the dermal and the mixed nature, based on that, the treatment options should be advised to the patient accordingly, uh, uh, and the treatment options I've told you the topical components, the oral components, and then there are lasers also. So thank you everyone, and if there I cannot see any more questions, so I'll end my session here. Okay. Thank you everyone, and thank you for making me part of this this session. Thank you.